Okay, I hope you can all see the slides clearly and hear me. So I will get started. Our COVID cases as of today, over the last 14 days, we've had 504 cases. To put that in perspective, when you looked at the 14 days prior to July 6th, we only had 183. Our average cases per day now is 36, and compared that to July 6th, when our average cases per day were 13. So we have seen almost a 300% increase in the number of cases. So cases are going up. Our percent positive right now is 5.4%, which is increased. And as I said, the 289% increase in cases in the last 14 days. Looking at our vaccination rates, you can see that our partially vaccinated rate, you can see the rate by race, and then you can see the rate by age. I will note that there is a misprint there. Actually, our 12 to 17-year-olds, we're at 35% of 12 to 17-year-olds are now partially vaccinated. But all the other numbers are correct, with 50% of the population now partially vaccinated. That's all ages. 47% fully vaccinated. And you can see on the left-hand side that 61% of adults are now partially vaccinated in Forsyth County. 61% of adults 18 and older are partially vaccinated. But, you know, we're really drawing attention to those younger age groups, basically 50 and younger, where we're 25 to 49. We just passed the 50% mark, but especially 18 to 24-year-olds and 12 to 17-year-olds. And then guess what? 2 to 11-year-olds are 0% vaccinated because the vaccine isn't even eligible yet. They're not even eligible yet. That possibly could be October or November. So we're keeping an eye on that, especially as we get ready for school and college to start back, with those younger groups that are eligible for vaccines still not having the majority vaccinated. And then also as we look at individuals who are not even eligible yet for vaccine. Vaccine availability is the same as it's been. We have the vaccine every day that the health department is open. We have vaccine available. We're also doing events. You'll see that on my next slide. We have had really good response from the gift cards. A typical day at the health department before, we would have 10 or 12 people come in. Now, since the gift cards, it could be 80 to 100 or more people that will come in. We had an event this past weekend at Rupert Bell Park, and we had 75 people come through to get vaccinated. And before that, probably I don't think would have been 10 people. So really excited about the increased number of people coming through to get the vaccine and take advantage of the gift card. Some outreach events that are coming up will be at Compare Foods this Friday. We'll be at St. John CME Church on the 31st. And then we'll be next week at El Bueno, Sermentino, Ludwig Street in Winston-Salem. So those are just a few of the events that are coming on. We're constantly adding new events and trying to, again, make the vaccine as available as possible. And then this is just a picture from our event at Rupert Bell Park. Thank you, Todd Luck, who's on the call, for taking all the great pictures. And the staff, we were there from 10 to 2, and as I said, had 75 individuals come through to get the vaccine. So with that being said, I'm done with the slides. I'll be happy to take any questions.
Hey, Josh, can you hear me?
Yes, sir.
Okay. Unfortunately, you guys may have to go back to having more frequent one of these video conferences just because of where things are going with the Delta variant. But I guess just going the most immediate topic, I'm sure you heard about the CDC reversing course on masking in schools. Do you expect to reach out in the next day or so to Forsyth County schools, given that they originally were scheduled to actually talk about and maybe vote on masking tomorrow night?
Yeah, I was just on the phone with Trish McManus before this call. And we, myself and Dr. Ohl and her, plan to speak hopefully this evening.
Okay, so not necessarily to play 2020 hindsight, because certainly anybody could, and over the last 16 or 17 months with how guidelines have changed, but did you anticipate this having to happen again?
Well, I don't think we would be here if we were at 75% of our population was partially or fully vaccinated. I think we hit that brick wall in early April, and it just was so slow. And the way that these variants are, I mean, we've all seen the not memes, but the videos and displays of how herd immunity works, or how, you have to have enough people vaccinated to stop it, to stop the virus from being contagious, from moving to person, from mutating. And what we're seeing with this Delta variant, is very, very contagious. And 94% of cases right now, what we're seeing across North Carolina, are people that are not fully vaccinated. So there's a few cases of people that are vaccinated. There's some breakthrough, but it's still an overwhelming majority. 94% are people that are not fully vaccinated. So, it's since the beginning, it's been a race against the vaccine versus the virus, And the slower we are with people getting the vaccine, then the virus can get ahead. So I'm not surprised by this.
And well, I'll tell you what, if there's anybody else that can ask questions, go ahead. Otherwise, I'll keep asking.
Anybody else, Wendy or Keith?
I'm good for the moment.
Okay, Richard.
Okay, so obviously, 12, like you mentioned just now, 0 to 12 cannot get vaccinated. But we've had vaccinations for 12 to 17-year-olds for what, 2 months and change, and yet you're only to 35%.
Yeah.
Not necessarily to say that you're disappointed or frustrated by that level of vaccination, but certainly, and obviously you had Dr. Oil basically say that, people needed to start the vaccination process in the middle of July just to be fully vaccinated by the time school starts. So is this a situation that people just are not hearing the advice to get vaccinated for those 12 to 17-year-olds? And what do you think's causing the hesitancy now?
Well, I think one, I will say we are better than some other counties. And again, this is all state data. You can look at it, but we're doing better than a lot of other counties. But it's still, especially in these younger groups, the 12 to 17-year-olds. But still, 35% is still a low number. Only 29% are fully vaccinated. And yes, your 15-year-old may get COVID, and they may not have that many medical conditions. But what about their parents or their grandparents or those teachers or those other family members or friends or parents' friends that catch it? Another thing I would say is, even if it's not about the medical piece, but just think about how this could disrupt your life, how it could really could disrupt school this fall if you're having whole classes almost have to be quarantined. So it's that's why, like we said, it's the best thing that we can do is for the majority of people to get the vaccine. And we've already seen how the vaccine works, especially among our older population, where we got 87% of people 75 and older who are vaccinated. So that's been great. They've responded. It's getting the vaccine, and especially you just think about 12 to 17, 18 to 24, that age, middle and high school and college, and just being that age, you're going to be around so many more people. So there's so many more chances for exposure.
So at this point, you also saw the recommendation not only for masking in K through 12 schools, but to increase masking again in indoor venues. Do you anticipate we could get to the point where people may have to rework from home?
Yeah, I would imagine. I think that, a lot of people, a lot of businesses are still doing that. I think some, depending on the type of business, several businesses have seen it be a good tool for, and they've seen, depending on the industry, that their productivity has stayed the same or probably improved. But, I don't know what we'll see as far as the cases. We were at 250, 300 cases per day in late December, January, that time frame. Will we get to that? I don't believe we'll get to that. But could we get to where we're 100 cases per day? Maybe we might get close to in the 80s and 100 cases per day. And the thing that's concerning is what we're seeing so far is the majority of our cases now are in that younger population, and school hasn't started back yet. So what's going to happen when it does? Things are more opened up. I think it's good advice from the CDC for people, to begin wearing, thinking about wearing masks and wearing masks more often, especially indoor settings where there's a high number of people, especially because, we've seen that the Delta variant is so much more contagious.
Now, we're about 3 weeks out from the 4th of July holiday period. How much of that's involved in this?
Probably,
Just people being out and about.
I think it could be. I think between that, vacation season, just cookouts and things like that where people are around each other a lot more. Also, just think about it. I mean, it's so hot here in North Carolina this time of year that everything's, in the spring we could stay outside, but now we're all driven inside. So that's we're going to be closer to each other. And that's what we saw last year. I mean, we started seeing cases go up in the summer. First of all, it started with our first one was Mother's Day, then Memorial Day, and then it just kept going through the 4th of July.
And I guess one last thing, you're talking about the 80 to 100 people coming in and getting the cards. Is that per week or?
No, our numbers per day have drastically increased.
So where you stand on how many gift cards you have left?
We have, I don't know the exact number. We had initially requested 1,000, then we requested 500 more. We still have a supply inventory, and we can ask for more. So I don't feel that we'll run out. But this is a temporary program. The state has told us initially that it should be a 6-week program. So we've got 1 week down. So that's why we would encourage people to take advantage of it.
And like I said, another hindsight 2020 type question, but do you feel like if they had offered $50 gift cards, $100 gift cards rather than $1 million lotteries, that might have been more effective?
I guess it depends on who you ask, Richard, because, for me, I like the idea of the sure bet. Hey, here's my $25. I've got it. I'm going to get it. Maybe some people want that chance at the big money. But yeah, I mean, I will just say this. What we have seen after the lottery was announced, we saw very little increase. I mean, just anecdotally, we might mention to someone and they'd bring 2 or 3 friends by and they're like, oh, I want to get it. But we didn't, overall, we didn't really see an increase, but we definitely saw an increase after the gift cards. So looking at that, yeah, maybe at least what we've noticed, it probably would have helped better to have had the gift card sooner.
All right, thank you.
All right, thank you, Richard. Wendy or Keith, any other questions?
Do you plan any outreach over here in the Kernersville area? You got anything planned?
I am sure, Wendy, we have a long list that goes into we're probably already sketched out planning and stuff in October. I'd have to look.
Okay.
I always I don't like to put stuff out too far in advance because
yeah.
one, things change. I mean, we have had stuff added. Usually it's people will cancel at the last minute. We've had that happen a few times. We've had to put it on Facebook.
Mm-hmm. Any kind of push you guys are going to be making before school starts? Any thoughts on that or plans?
Well, we did the events we were, I believe, at Parkland and Northwest Middle a few weeks ago. We're also doing some back to school events, just also not just COVID vaccine, but other vaccines that are required for kindergartners and seventh graders, 12th graders. So we're working on that, offering those at the health department. And, for those for the COVID vaccine or any other vaccines that kids need for going back to school, they're able to get that anytime here at the health department.
Okay. Have you ever, I have family members, and this is just from personal observation, that I know of people who are so dug in on this anti-vaccine, the COVID vaccine, that you can't even talk to them. They get angry. Have you ever seen this kind of, it's almost a visceral reaction to a medical crisis, and it's just they're dug in? How do you combat that?
Well, we in public health, I've seen, not to this level, I've seen where people get very passionate against vaccines just for other vaccines. I've seen that happen. Also, looking at the history, I read a book about the 1918 pandemic, and there were anti-mask leagues that were created in cities, and people would burn masks and things like that. So it's
not unprecedented. It's happened before.
It's happened before, but I think with everybody having an iPhone and a social media account, that's made things a lot different. And there's lots of opinions out there, all over the place. But it's people get very upset.
They certainly do. It's almost a taboo. You can't talk about it. It's almost like politics. You just can't talk about it.
Yeah.
So anyway, that's an observation. I don't have any other questions.
Okay.
Hey, Josh, let me ask one more question, if you don't mind.
Sure.
Okay, so when the governor relaxed his masking mandate in schools to allow people who are vaccinated to go maskless in school, certainly he and Dr. Cohen had made some strong recommendations, and even Dr. Cohen said at the end of the press conference last week that these school districts are responsible for making sure their students are safe, and they'll step in if they don't. But do you have any idea how far do you feel like? I want to say Winston-Salem, Forsyth County schools may be more reasonable than some other school districts, but do you have any idea what might happen if a school district doesn't adhere to what the CDC is recommending, and/or likely the governor will recommend?
Well, I think a lot of it is dependent on, the school system. Obviously there's a big difference between a high school that has 300 kids and one that has 2,500. We saw that with, it seems like this has been going on almost 2 years, but with graduations, I remember where there were some schools that would have 75 kids graduate. Well, they could figure it out probably either in a large auditorium or outdoors, or something where Reagan and West Forsyth couldn't necessarily do that. I'm talking about the 2020 when we were the first few months in. But so it depends on the school system, I'm sure, and the density of the and number of students. I will applaud, Winston-Salem, Forsyth County Schools has been, we've been in constant communication with them. And I know that their superintendent, McManus, has reached out to me, reached out to Dr. O. And like I said, we'll be talking. And I know that's a school board decision, but I do believe it is in the best interest of the school system and of, the health and safety of the students and the staff and the families, that they wear those masks.
All right.
I think I would say at least early on for the first month or the first 9 weeks, until we see how this, the Delta variant, what happens. But my concern right now is I think in the next, where I said our cases went from 13 to 36, I think it could double or triple again in the next by October. Again, so we might be back up to 80 to 100 cases per day.
That's all I have. Thank you, Josh.
All right. Thank you all very much. Have a great day.